stuff. So this platform we're going to run through first is branded MyBotGP. So we are an automation company, and we built a brand called MyBotGP that is specialized in supporting primary care, essentially. The intelligent pathology management platform is there to help manage the clinical interpretation of your pathology tests to make sure that you see the path test that you want to see. Okay? All of our kit, it's important to say, is delivered from NHS Cloud. We are fortunate to be an NHS ICT partner. So we are a private UK business. It's important to explain what that means. However, unusually and good for us and for our clients, we are an NHS ICT partner. So it means that all DTACs, DPIAs, data sharing agreements are pretty straightforward for us. All of your MyBotGP range or your kit, if you were to require it, will live in NHS Cloud. Nothing is taken outside, and we can't see any data. Right? So DTACs and DPIAs, and that applies for both products. This particular product is a medical device. It has DCB 0129 and DCB 0160, and we can cover that off a bit later if we have time and if there are any questions. So what's the principle behind this tool? Essentially stop wasting clinical time and cost and headspace. So you're extremely busy and you get thousands and thousands of pathology tests a year, and in reality you only need to look at a portion of them. Okay, every normal result deserves the right level of review and not the same amount of clinical time is essentially the catch line. MyBotGP will intelligently automate the filing and contextual assessment to flag or file, so clinicians focus on where their expertise is needed. MyBotGP essentially is think of it as a big platform, a big filter that sits at the front of the practice. Our kit can look after over 200 different pathology test types. I think we're up to 220 different pathology test types now. And it will run an initial sweep on the path test results as they arrive at the practice to determine whether you need to see that path test or not. And I will go into more detail in a moment as to how it does that, what the rules are, and all of the detail and what the rules are and how it works in reality. Our kit specializes in looking after normal pathology tests, but obviously not all normal test results can be dismissed because you may want to continue your exploratory work with the patient. So this platform is now touching almost 3.8 million patients across the UK. We're processing thousands and thousands of pathology tests every single day. It is not a new platform. It is a fairly well-trodden path for us, fortunately now. Cost and time saving up to 30 minutes a day per clinician, and we'll explain to you what that means in a bit more detail now. So for the purposes of the business case, we're going to use an 8,500 patient list as an example that would have up to 5 partners. Okay, obviously some 8,500 lists will have more partners or fewer partners, and not everyone in this call has that list size. Some will be larger, some will be smaller. On average, an 8,500 list receives approximately just under 62,500 pathology tests a year. That number, incredibly, is quite accurate. And what we mean by that is if you were to take a list of half the size, they'll receive roughly 50% of that, and double, they'll receive double, and triple, they'll receive triple. Obviously not to the exact number, the differences in patient demographics and how many path tests are requested at practice level, but it's quite a good amount. So essentially what the scenario what you're doing at the moment is every clinician is essentially at this 8,500 list. They are looking at a massive continuous clinical workload of reviewing somewhere in the region of 62,500 pathology tests a year. Now, around 80% of those, and actually the figure is more like 85%, are normal or come back from the lab as normal, but obviously the lab isn't taking patient context into consideration, they're just looking at the path reports. So they're sending 80 to 85% back as normal, and that's somewhere in the region for this 8,500 list of just under 50,000 pathology tests a year, in principle, are coming back as normal. Now, within those just under 50,000 pathology tests, approximately 20% of those tests may require additional patient contextual checks, which are performed manually by the clinicians. What we mean by that is the lab says it's normal, you might be happy to file that, or the lab says it comes back as normal, but you would want to go back into the patient record to check for a percentage increase or decrease, or a health condition perhaps, or you may want to set your own ranges. You may disagree with the lab ranges, and you want to set your own ranges and actually supersede the lab. And before deciding as to whether you can just file that path test or whether you need to continue your work with the patient, and all of that work is being done manually. So what you've got is a scenario where you have a highly skilled and busy resource opening thousands and thousands of path tests whenever they get a chance a year to confirm whether they actually need to look at something. Invariably around 40,000 of those path tests in this scenario, or 45,000 roughly, could have just been filed and didn't need to be looked at. And then within that, there are the ones that you don't want to slip through the net and that you want to flag. Now, MyBotGP does all of that for you, fully automated, 7 days a week, 365 days a year in the background. So think of it as a big safety filter. We now can manage up to 20 different pathology tests. They will all pass through MyBotGP, and it will look at them all and say, right, I'm allowed to file that one. That one I need to check for this, or that one, and it will go into the patient record, could check for a health condition, percentage increase or decrease, or it may say, actually that one, this particular practice prefers to use a different protocol. I'm going to supersede the lab and then decide whether this can be filed or whether someone needs to look at it, and it does it fully automated. So we're freeing clinical capacity, reducing errors as well, because you can enforce standardization of the practice. Human error is a thing, and essentially stopping you from wasting clinical time, and there's quite a large cost footprint to allocate this to do this task manually. So in this scenario of an 8,500 list, it's costing the practice, because obviously practices in the UK are set up as UK business as a business, it's costing somewhere in the region of £50,000 a year of clinical cost capacity, practice clinical cost capacity, to clear your normal path tests, although obviously not all normals are normals. And our kit will significantly reduce that. So this is just a bit more on the business case, but the most interesting thing will be the rules and how it works. And I can show you some examples, which we'll get to in a moment. But in principle, it works out somewhere in the region of 1.5 days a week of clinical time are allocated to that, in 95 days a year, and that's where the £50,000 comes from. So this is the piece that we were just going over high level, and I'm going to move to this piece afterwards, okay, which are the rules, and I'll explain that in a bit more detail. Path tests arrive in 4 categories, essentially in 3, but we can call it as 4. Normal, you don't need to do anything with it, can be filed, or you may want to see that path test because you were making sure that the patient didn't need something, so you were double checking something. Normal, but requires a patient contextual check. You may want to supersede the lab and set your own protocol. And abnormal. MyBotGP will pick up the first 3 for you, fully automated. So in essence, what happens is when you look in your inbox, you will just be looking at pathology tests that you want to look at. So that will be abnormals and normals that relate to patients where you want to continue your exploratory work, either because it's found a reason to fail that test or because you wanted to omit that particular test for that patient at that time. So, as I said before, we're now up to 220 different pathology test types, which is a lot. Most practices receive somewhere in the region of about 120 different path test types, but there are practices out there that get considerably more, and with our footprint now, we're seeing more and more and more. Additional safeguarding. It will decide by itself which can be filed and which can't be filed and which needs to be flagged. And when I say decide by itself, you set the protocols. This can be bespoke at practice level, where we work with PCNs and well, of different practices across the country. Some may have a preference for a particular protocol for a path test, and another may have a different one. You can enforce that in MyBotGP. Also, you can do the inverse, where we work with large buying groups of multiple sites where they want to enforce the same rule set across multiple sites. That's also possible. MyBotGP files directly to the patient record as well. It is a System 1 or EMIS user. Why that's important? It's important because when the patient logs in through their app, they will still see their path test results. So we're helping you save time there as well. In addition to that, if you would like to send text messages, you can send a text message at path test type using Accurix or whichever application you're using. So here are the rules. I'll get through these. I'll show a couple of examples, and then we'll stop for some questions, and then we can see where we are and circle back, or we can move to the next product. But essentially, you can combine powerful rules to validate over 220 different pathology test type results safely and with full control. So all of your tests can be added in principle, and we're not saying that every client adds all of their tests. Different practices have different preferences. But in principle, you can add all of your tests. We tend to see most of our clients maxing out sort of 90-95% of all of their path test types. MyBotGP can check in the patient record for a health condition. So you could say, file this path test if it comes in as normal, unless the patient has this health condition. And it will go off by itself, check for that health condition. If it finds it, it won't file it. And if it doesn't file it, it can file it if that's what you want it to do. You have the flexibility to use the lab ranges. You're also able to supersede the lab ranges to see more or fewer pathology tests as per your practice protocols. So we have clients who supersede path test lab ranges for things like prostate, EGFR, lipids. There's some various path tests where they believe that they have a better protocol. And again, we can go into more detail on that, where they set their own protocol. For example, with prostate, most of our clients supersede the labs and put 4 or 5 age ranges, 4 PSA or 5 PSA ranges, numbers, and check for cancer. But again, we'll cover that in a moment. MyBotGP can go into the patient record and it can compare against a previous test result to measure a percentage increase or decrease. So exactly as it sounds, you can say, I'm happy to file this test as long as it hasn't gone up or down by a certain percentage. Now, if I bring this back a moment before we move to the next rules, you can actually combine these rules. So in principle, you can supersede a lab and check for a health condition and check for a percentage increase or decrease. We've got a library now of rule sets for pathology test results and different protocols spanning multiple sites across the country. And when we configure the tool for you, a lot of them will be fairly straightforward, and there will be pathology test types. We can show you examples of what your colleagues have done across the country. And if you agree with any of those, you can use those as well. So you can also supersede in terms of age and gender. Now, the next one is pathology report scanning. It's quite interesting and important, that one. So you will get a number of different test types, perhaps 5 or 10, but they could equate to 5, 10, 15, 20,000 a year that don't use numerical ranges. So our kit can actually read words and make decisions on words on path test reports as well. So what we're saying is you can look after path tests that have ranges. MyBotGP can also look after path tests that use words, so positive detected. It can also pick up warnings on lab reports as well. So you could say, I'm happy to file this unless you see this warning. So the principle behind this tool really is the volume. It's going to grab everything, all of your path tests in regards to what it's been given permission to do. There aren't really any limitations. Now, you can also omit patients. So if there are specific patients that you would like to omit, that is possible. In addition to that, you can omit test requests when requesting. So if you wanted to rule out something for a patient and you wanted to know when that normal came back, if it's coming back as normal, you can do that when you request the path test, and that one won't be filed by MyBotGP, so you don't have to worry that in that scenario it slipped through and you haven't got the result that you were hoping to see. Additional safety net. We can SMS patients. As I touched on before, results are filed to the patient record in EMIS and System 1 as you do now. Nothing changes, so you don't have to worry about a brand new system coming in and things disappearing and going to different places. It's essentially a user at the practice, like employing a person. Results are filed against the patient, which means that when the patients log into their app, everything will be the same. They will be able to see the results. You can send a text message, and obviously being a medical device and something that as important as this, needless to say, there is a very comprehensive audit log that goes with it, so you can easily track absolutely everything. We send you a summary. You'll get an automated summary at the end of each day of what the tooling has done that day for you, and then for more detail you can easily log into the platform, or we do that for you, and get a full breakdown of all the path tests linked to all the patients, all anonymized, so you can evidence everything and you can go back and double check everything. Okay, so this is the config panel. This is your platform. You will have a copy of it. You will be able to log in and out of it whenever you want. We configure it for you, stroke with you. So you don't have to panic. This is quite a small picture. Doesn't take long to configure. Most clients are pretty much fully configured in about an hour and a half, an hour 45 minutes, and we do that over a couple of meetings. Because obviously we can pre-populate everything and give you examples. But just for this example, this is a liver function test. Let's say that you've received this liver function test with these ranges from your lab, and MyBotGP will have picked up the lab ranges directly from your lab. You would simply look at that and say, do you agree with the lab ranges? Do you want to set your own protocols? Would you like to do additional checks, or are you happy to file it? If you are happy to just file it and tell MyBotGP that every time that this test comes in from the lab with these ranges, you click file for normal report and it will be filed. If you don't and you want to supersede it, you can quite easily write your own ranges in and just adjust the protocols. Here where it says, previous test result, you can ask it to check against the previous test result for a percentage increase or decrease for any of the tests or subtests. And here's the keywords. This is where you can say check for a keyword to be present or absent or on the problem page. And this is where you're saying to MyBotGP, I'm happy to file this unless you find this word, and it will go off into the patient record by itself, or check the pathology and check the pathology test report by itself and do that check for you. If it finds it, it won't file it, and if it does it, it will evidence it to you or file it. Comments and filing strings, that remains the same. If you think back to what we were saying before, this is a user of EMIS or System 1. I know we have a mix of practices on here, so you'd still have your same comments and filing strings. What we would do is set up a username, call it your practice pathology management filing, or you could give it a name, whatever you want, and then it will use the remaining the existing comments and filing comments to file against the patient record. So here's a few examples, but here's a bit about our medical device status, NHS Cloud, NHS ICT partner. We have DCB 0129. For those of you that would like it, we have a DCB 0160 that we've drafted and we give to our clients at no charge as well. Our clinical safety officer is a UK practicing clinician. We thought it was important to have a safety officer who's actually doing this work, and they have drafted the 160 for us that we give you. Now, I want to go back and show you a couple of examples, and then what I'm going to do is stop for some questions. I can work out how to, there you go, how to shrink that slide. So just open up this spreadsheet now. Sanj, is the spreadsheet showing? Yeah, okay. So what I'm showing you now is one of our clients has given MyBotGP permission to look after 181 different pathology tests for them. And this is their rules, essentially. These are all the path tests that they've given MyBotGP permission to look after for them, and the rules that they've associated to decide whether they can be filed without being seen or not filed, okay, and where they may have superseded the labs. Okay, now please note this is an indicative example. You can change the protocols if you think that's better for your practice. This is just an example of what they've done. They've just kindly let us share their path test rules just so we can give you some examples. So what you're looking at here is path test name, subtest name, gender, age, check for normals, ranges, check against the previous test result, check for keywords. Remember we were saying check in the patient record or patho test report. Comments and filing strings. Okay, so basically, essentially what you're looking at here, and we gave the same examples on the previous webinar, but I can run through them here. These are the rules. Do you want to check for a health condition for that test? Do you want to use the lab range, supersede the lab? Do you need to check against the previous test result? Do you want to supersede in terms of age or gender? Do you need to look for words or warnings? Because that path test might have a range and a warning, or it might not have a range. It might only have words. Send text messages. Okay. So if you look at the first test here, which I always like to give as an example because I don't want to overcomplicate this. This kit will file thousands of path tests for you that you may not want to do any additional checks on. So that's going to run in the background. But what we're going to show you now is where you want to add some more functionality for the particular test that you think it would add value and save you time and enforce rules for better safety. So this is a 24-hour sodium test. Subtest is 24-hour urine sodium. This particular client has said they are happy with the lab range 27 to 287. They don't need to add age or gender checks on this particular test. They also don't think it will add any value at all to check against the previous test result. However, what they would like MyBotGP to do, and if you look in where I've clicked on keywords here and you look in the top left hand corner, is they would like it to check if the patient has diabetes or chronic kidney disease. So for this client, they've said, agree with the lab, happy to use the lab range, file it away, but before you do that, have a look, and if you find that, let me see it because I want to see that patient. So that's an example of the keywords. This is the example of the prostate example I gave before. What you can see here, this particular client has set up 5 age ranges. We do have clients that set up 4 age ranges. And you can see here, they've said ignore the lab because their particular lab gives 1 range. So they want to cut it up between 18 to 39, 40 to 49 years old, 50 to 59, 60 to 69, 70 to 150. And you can see they've superseded the PSA level ranges here, 2.5, 2.5, 3.5, 4.5, and 6.5. So essentially saying, please use these ranges for these ages. However, as an additional safety, to be safe, they've said, we also want you to check and see if the patients have prostate cancer or metastatic prostate cancer. And then obviously, even if it's past the superseded age range, if you spot they've got cancer, don't file it. We need to see that path test. Right? And the other example that we can give quickly here before we go for questions, because obviously we've only got an hour here and we're going to jump into Docman afterwards, is HbA1c. So this particular client has said use 20 to 41. But if the patient's got diabetes or pre-diabetes, we want to see that path test and stroke or their lab, even for a normal, gives a warning of pre-diabetes. So they said happy with the lab range of normal unless you see this warning. If you see this warning, then please flag this result. And here you can see some of the comments and filing strings, which will all be quite similar across the country. But again, they'll be bespoke. They'll be bespoke to you. Normal, no action. If satisfactory, continue. So there's a few examples of that, of some of the functionality. What I want to do now is we'll go back to here. Okay, so we'll buzz through these fast, and again, any other questions, or if we don't manage to get through everything, we can follow up with a phone call and another presentation. It's no problem at all. So will this be recorded so we can share with colleagues? Yes, it will. We will get it onto our website. Normally it takes us about a day or so. And then we will share that with everyone afterwards, 100%. Our lab is now reporting all the bloods in one report rather than individual ones, which used to be previously. How will this work when the report is abnormal? System 1 or EMIS, I think, is the answer to that. We can circle back to that one.
I can just
answer that.
Yeah. If it's a batch, not a problem. We can extract and it separates out all the path categories within that multiple, and then it will check that against your rules, and then we'll file them if they're within range, and we'll file the normals. So any batch multiples will be filed as normal. And again, based on if you're EMIS or System 1, if you're EMIS, it will, as I say, file the entire batch. If you're System 1, as I say, it can file them singular within that abnormal. So if you did have 1 abnormal within that and 6 normals, it would file the 6 normals and leave the abnormal, because System 1 allows you to do that. But yeah, so hopefully
Cool.
that
Thanks.
answers your question.
Thanks, Sanj. I'm just checking the time here. At my practice, we have 32,000 patients. Our main problem is auto-filing, which means we clear the pass in the morning, but by lunch, the clinicians have 20 or 30 results. Fine. Yeah, our kit will runs throughout the day. And it does more than the auto filing, because you can run obviously the additional patient contextual checks. You can check for percentage increases and decreases. You can supersede the lab ranges as well, and you could combine those rules. So it does a lot more, and it's fully automated, and that's massively important, because it's going to run throughout the day, every day, 7 days a week. Also comes with a DCB 160 and a DCB 0129, so which is really important if you've got a machine that's taking clinical responsibility over path tests, even if in principle they are like a portion of normals. You still need to have all of that stuff documented. Where's the data stored? All in the UK. Everything's in NHS Cloud. Sorry, Sanj. Yeah. Yeah,
Yep.
well, yeah. A little confused about the pricing. We'll circle back to the pricing in a moment, but in principle for this, it's 749, list times 30 pence, and then depending on the amount of patients you have, it would be 7.6 or 5 pence. But Ben, we can circle back on that one. Sorry to rush. It's just we've got to get through the other products as well. If you use a wider range than a lab, would the patient still see on the NHS app normal or satisfactory? It would be your keywords, however you want to do that. So you still have full control over the wording and the filing against the patient record. Can other surgery templates be imported to ours instead of starting from scratch? Yeah, don't worry about that. 100%. What we this is a well-trodden path. Without going too technical, we plug MyBotGP and it will suck out all your path tests directly from your lab, so it comes pre-populated with all the path test names and ranges, and then we know, obviously, give or take, what most clients want, and then we have a couple of meetings and you just can bespoke to make it perfect for how you want it to work. EMIS, good. Patient specific criteria, you can omit patients with our kit. You can also omit path test requests for patients, so when they come back in, they're skipped, but in this version it doesn't track individual patients. Can you link with pre-written texting, emailing to inform patients' results are normal automatically via Accurix? Yes, it will plug into your normal Accurix. So any templates that you use will remain the same. What we're going to do is we'll do Docman, and then we will circle back for more questions on Path and Docman if you have them. So please bear with us. So yeah, I mean, it's just a bit more about the business case. It all relates back to this first slide. Why on earth have you got people opening things up to confirm they're normal and file them? And in addition to that, if you can now automate the manual patient contextual checkings safely, within the NHS, so that will be taken off your plate. One less task, well, not one, there are thousands of less tasks to do a year. So that's a bit more on the business case. 30 minutes a day, 1.5 days a week, 95 days a year just for an 8,500 list. So I showed this really quickly before, but it's important. We have all of the certifications. We are fit for purpose for the NHS. Again, this kit's touching about 3.8 million patients now nationally. This is not a new product. All delivered from NHS Cloud with DTAC, DPIA. And we actually, our history is we came from a Health Innovation Launchpad program. Again, a bit about the pricing here, which we can cover off later. But in essence, that 8,500 practice, it costs them about 3,887 a year, which is roughly £75 a week, roughly. There is a setup, there is like a product fee in there. So if you were double the size of that, you wouldn't pay double. It's about 8,500 is 3,887. A double size list or a 50% list. A double size list wouldn't be double, but we can share costings afterwards. Great. So apologies to rush that one. What I'm going to do now is we will now show the Docman presentation. Any questions on that? Again, we'll follow the same format. We'll run through this. If you have any questions, please pop them in the chat, and we will go through the questions with you. We'll get through this in hopefully about 20 minutes or so, and then what we'll do is we'll stop for probably 15 minutes. We'll stop for questions, and then, like I said before, we'll circle back for questions on both Path and Docman. Obviously, for our TPP clients, our pathology management platform works with TPP System 1 and EMIS, whereas this, you must be using Docman for it to work. And we will be launching an equivalent for System 1 later in the year, hopefully. So this 8,500 scenario list that we paint, just because you have to pick a size for presentations, so we just went with 8,500. Again, these numbers are quite accurate. Unbelievably, 8,500 list gets about 125 letters a day. A list double the size will get approximately double that. Again, slight variations for patient demographics and stuff, but that number is pretty accurate. Staggering, almost 40,000 letters a year. All of those letters have to be validated against the patient. People forget about how they actually get onto the system. It's important to say that MyBotGP, what we've done with our product to keep it sort of clean and accurate, the principle behind this product is not to clinically code letters. But I'll explain to you what it does. And there's a reason why. There's only one thing at the moment that can clinically code letters, and it's not right to refer to it as a thing, but that's a human being. Because if you clinically code a letter, you have to be able to action that letter and then take responsibility for that patient. And there is not a machine that can do that yet. It is coming, probably 4 or 5 years. There's stuff that will have a guess and then ask you to double check and charge you lots of money. So what's the problem? So this 40,000 letters a year or 39,000 letters a year, all of those letters, they arrive at the practice, they've all got to be validated against the patient. It takes time. They then have to be added to the Docman template. It takes time. IntelliSense might pre-populate it, but someone still needs to validate it's correct. They all need to be filed, and then they all need to be actioned. And whether that action means you don't need to do anything, or it needs to go to a personal folder, or you've got to set a task, not a task, do a template, all of that has to be done. Massively time consuming, highly complex. All of your letters you can have, we've got clients with 200, 300, 400, 500 different letter types, 6 iterations of the same letter from the same hospital, from the same department. Someone needs to understand what they're doing. It's highly complex work, and obviously you need to get through them quickly. And then the process is quite fragile because it's very manual. Holidays, sick leave, recruitment, backlogs. It's almost like firefighting constantly. So again, our kit, MyBotGP, is on 365 days a year. We estimate that an 8,500 list is allocating 203 days a year just to do this task. And that's not including the clinical piece. And our kit obviously will ensure that everything is dealt with that day. So here's an overview of what it does. So MyBotGP collects letters and emails directly from Docman. So it's essentially a Docman expert that you tell what to do. Think of it this way: all of your letters come in and you know what you want to do with that letter. So we tell it what to do with that letter, and then it will do it for you. So it's going to collect the letters and the emails from Docman. It's going to validate and complete. It's going to confirm the letter is valid, for example, a patient match. It's going to complete the Docman template by itself, and it will file on the patient record all letters. So that piece of work is now done by a machine. You don't have to do that anymore. Now, what do you do with that letter? Well, MyBotGP can use all of the Docman functionality, which includes tasks, templates, folders, triage, usual GP, hide letters, don't hide letters. It's up to you. So when it comes to root and file, you will essentially tell us, for this letter, James, it doesn't need to be seen by anybody. You don't need to set a task. Happy with you just to validate the patient, complete the template, file it against the patient record. No task, just do that. From that point onwards, that will happen with that letter. So similarly to the Path product that we went through before, it's stopping you from having to open things and look at things to confirm you don't need to look at it, which is, which is nonsensical, but it's just the way that you're working at the moment. You've been forced to work at the moment. So the second thing is there will be a portion of letters that you want to triage to coding teams or folders for other people to collect from or create tasks. So you tell us. So you say, for these particular letters, we don't need to see them. Please file them. Just get them away. Next letters, yeah, file them, validate the patient, make sure it's a valid letter, get it on the system, file against the patient record, and then I want you to send it to this team or person or folder. and we will and MyBotGP will do that for you. Some clients, they have multiple different folders for multiple letters. Some have a couple. Examples could be pharmacy teams. You could just say all pharmacy letters go into that folder, and then they fish them out of there. And then for some letters, again, it changes from practice to practice. All practices tend to have their own protocols. You can triage, obviously, letters to usual GP as well. So it's quite a straightforward process. We plug it in, it will suck up all of your letters. We then say, right, we've got all of your letters. What do you want MyBotGP to do with them? So yeah, file those, don't need to see them. Those ones need to go to this particular team for coding, and they'll just fish them out of a folder already on the system, already validated against the patient, so they will spend considerably less time on that task. And the remaining and other letters triage to usual GP, so you can be sure that you're seeing them as quickly as possible, and you're not, no backlogs. Works 7 days a week, 365 days a year. So you won't come in on a Monday morning or come back from holiday and find several hundred letters. It will have plowed its way through them. And just like the question that we had for the pathology management platform, this tooling works throughout the day. So it's consistently going to be grabbing the letters as you get them. Now, some letters might have warnings on them, or will have warnings on them rather. So the kit can actually read letters as well and look for warnings and keywords and things like that. So where that becomes important is, for example, if you go back to option 1 here, file letters that do not need to be seen, or triage letters to usual GP, you can say, file this letter, get it on the system, complete the template, file against the patient record. We don't need to see it unless you see, maybe for a 111, attempted suicide, for argument's sake. And then MyBotGP will do that for you. So an example would be, file all these 111s, don't need to see them, but if you see this keyword, attempted suicide, create a task, send it to this particular person, whatever you want done at that practice, and it will do that for you. So stuff like DNAs, pharmacy letters, negative retinopathies, all that stuff just disappears. Obviously, again, same as our Path product, there is a full audit log of absolutely everything. So you've got full auditability at any time to see what letters have been touched, what letters haven't been touched, where they've gone, and what's been done with them. And again, the principle is, you're very busy already, constant masses of work coming through. Release some time. Get some standardization, get some enforcement, make sure that a job is done by a machine every day, and you don't have to worry about it. And you can focus on the important stuff, like coding if you have a coding team. Experts with EMIS and Docman, obviously. This particular kit has DCB 0129 certification. We have also drafted a templated DCB 160 for this as well, which we give clients at no charge, and you're more than welcome to have if you buy the product. Again, it's delivered from NHS Cloud, so all secure, DTAC, DPIAs, all locked down. There's no issues. We can't see any data. We can't see letters, so everything stays in your environment, and that's just something we covered before. Very high level on the audit log. But in principle, all you need to think about from an audit perspective is there proof of every letter it's touched? And the short answer is yes. And there would have to be, or we couldn't sell the product. This is priced the same as Path, but there is an additional £1,250. So this 8,500 list, this will come in at 5,137, and that's for unlimited letters and unlimited volumes. So it's basically, it's list times 30 pence plus 1999, and then there's a cloud fee, which is basically for a machine in the sky, and that depends on how many patients you've got. Looks a little bit confusing, and we are working with our NHS colleague partner to try and tidy that up a bit, so it's a bit more simple, and we can give one figure, but we can give you the exact figures. But in principle, this 8,500 list is coming in at 5,137. If you were double the size of this 8,500 list, you would not pay double, because this 1999 is a base subscription. And again, we can give you prices and quotes afterwards. So quick recap before we stop for questions for this product, and then we can circle back for both products. MyBotGP will grab all of the letters for you. Will validate all of the letters, the patients are correct. It will complete the template and file them all against the patient record. It can take advantage of all Docman functionality, which includes tasks, templates, folders, triage, usual GP, where some clients hide letters, make them invisible, and then make them visible again later. All of that stuff can still be used. You just tell us what you want done for that letter. Root and file all the letters that don't need to be seen. No task, that will be done for you. Triage letters to coding teams or folders. That will be done as well. Create tasks, and you can also triage usual GP, and it will apply your rules consistently every time. Full auditability, 7 days a week. So what I'm going to do now is stop for a moment. Sanj, are there questions? Okay, so we've got some questions here. So I'm stopping sharing for a moment. Let me just see where this is here. Trying to see where they start. We'll do the Docman ones, then we can circle back to the path ones. So can you, okay, I've got it here. Louise Farrell, will you pick that up to send a quote for, please, for Louise Law?
Will do.
Oh, I'm still in the abnormal ones. Thanks, Farrell. Oh, so it's already done that, so I'm just trying to find the questions. Right, here we go. Trials, we don't offer trials. These are mature products now. They're not new. They work as described, and there's quite a comprehensive setup on that. So a question from Western Road Medical Centre: will it extract data like blood pressure and code? I'm presuming this is for Docman. The answer is no. This kit is there to pick the letters up, validate the letters, and get them onto the system and file them against the patient record. So in that scenario, that letter will go to your coding team, but they wouldn't have had to have done the rest of the tasks. They would simply do that. Do you have to be using Docman already? Yes, you do. Can you stop results and Docman being sent to clinicians while on annual leave? Yep, you can. Can the Docman process be overridden for certain age ranges? For example, patients under 16 have letters sent to GP no matter what. Sanj, it sounds like one for you.
No, it's not able to do that.
Interesting. Okay.
Yeah, not seen that. Yeah.
Yeah. Interesting. Never seen him baffled before. We'd put that into our what we do is we keep a list of enhancements, like a tracking list of enhancements. So we'll look at that one. Tom, thank you for that.
It could quite easily be done and added in terms of that function, but yeah.
Yeah, okay, cool, thank you. No, the Docman product doesn't work with System 1. You must be using EMIS and Docman, but we are launching, for Louise, we are launching a System 1. I can see Sanj typing away. He's already putting that into the bucket list. We will be launching an equivalent for this for System 1 later on in the year. We have it in test at the moment, so it's running in some practices across the country processing letters. We just got to process like millions before we can then say, right, it's ready to go. But in principle, it's the same algorithm. It's just pressing different buttons in System 1 because it's MyBotGP that picks the letters up, recognizes the letters, and understands how to classify them and name them. Any more questions for Docman or System 1? We've got about 10 minutes left, so I'm happy to use that time to then go over. I mean, I can go back over both products again super quick. In fact, maybe we'll do that, and then if any other questions come in, we can address those. Here we go. A question from Sean. Just want to check the pricing example is for both Docman and Path Lab processing. No, they're priced separately. Each price is priced separately, but there is a discount bundle if you take both products. Again, Farrell, will you pick that up, please? With Sean, you can send he'll ping you over some prices and stuff.
Will do.
Thank you, Farrell. Thanks. Any other questions? So what I'll do then? Okay, I'm gonna. Oh, I've lost Teams now. Here we're back again. There we are. What is the notice period on the contract? That we minimum 12-month contract. Sanj will let me know if there are, but if there's any come up. So again, what I'm going to do is just skim through this super fast. Pathology automation platform. This is here to help clinicians free clinical capacity, time, cost, and headspace. Essentially, every normal result deserves the right level of review, not the same amount of clinical time. You're getting thousands and thousands a year that simply need to be filed. This will do that for you, and you're getting thousands and thousands a year where you may want to just set your own protocol or check something against the patient record, and ask MyBotGP to do that calculation for you, and it will do that for you. And that can be any combination of these rules. Check for a health condition, supersede the lab, compare against the previous test result for a percentage increase or decrease, supersede in terms of age or gender. Our kit, obviously 220 different path tests now. It can check the path reports as well for words. Important because you will get thousands and thousands of path tests a year that don't have ranges, and you may want to add those as well. Positive, negative, detected, not detected, or check for warnings. Obviously you can omit patients, and obviously you can omit particular tests for patients if you want to, so you don't have to worry about trying to discount something for a patient and then it gets filed and you don't see the test when it comes back in. MyBotGP uses EMIS and System 1 like a user, so everything is filed against the patient record in exactly the same way. It's not a problem. The patients will still see that through the app. This is the challenge, and you can double these numbers and half these numbers and triple depending on the size of the practice. 8,500 patients, just under 62,500 path tests a year. Masses and masses and masses. 80 to 85% of those can be put through the platform. So 50%, 50,000 path tests a year are going to get filed and managed in the background. Patient contextual checks done, fully automated, 7 days a week. Nothing slips through the net, and quick as well. Get some headspace back. Costing for that is here, and I'm just going to quickly do the Docman one as well. This PDF keeps fighting with me today. Here's Docman. That's the business case. Unbelievably, 39,000 letters a year, 125 a day on an 8,500 list. Every single one of those, whether they need to be seen by a clinician or a coding team or not, they still got to be validated. The patient exists. A template has to be completed and they have to be filed. Thousands and thousands a year simply don't need to see. MyBotGP will get rid of those for you. It can set tasks, templates, triage letters to coding teams, triage to usual GP, all of that functionality. So the deliverable, if you're using this tool, is all of your letters are put onto the system for you. All of the ones are gone that you don't need to see, and you will still have the ones that need to be seen by a human being to make medical decisions or actions or work out blood pressures as per the example before. Yes, you will still have those, but you won't have to do the rest of the work. And there is no tool that will do that fully automated for you other than a person, despite what you read. Some stuff will have a guess, but they will always ask you to say, have I got it right? Because if they haven't, they're in trouble for making a mistake. And they also cost 5 to 6 times the region of this platform. So this is a very, very sturdy workhorse that's going to grab everything, very clean profile. You know exactly where it starts and where it stops. So I'm going to stop there and stop sharing for a moment. If we circle it back now and see if there's any other questions that have come up here. Okay. This recording and my slides come to my email so the practice manager can have that. Yeah, 100%. Louise, will you, Farrell, will you ping Louisa an email or take track of that, or are you happy for you to pop your practice manager's email into the chat, and then we can make sure that they're added to the recording, Louise. Thank you. I've seen that pop up. I'm assuming that's you. Is this not using IntelliSense the same as Docman does when filing? Sorry, Sanj.
I'll pick that up.
Yeah. Okay.
Yeah, I mean, it's worlds apart from IntelliSense. IntelliSense, to give you the key aspects of the differences, IntelliSense sets the values based on predefined templates, as you know. What we do is essentially we run multiple combination checks to ensure correct departments and fields are selected populate during filing. And the key aspects are we pick up scans, emails, and also the main point is we actually file the letter. IntelliSense doesn't file the letter, so you still have to then check and then file. So again, it's chalk and cheese.
I think, yeah. I mean, just to add to that, it's like as Sanjay's saying. I mean, with IntelliSense, it's going to hazard a guess and then propose it to you and say, "Have I got it right?" And then you have to still look at every single letter and confirm it and change it and tweak it. So you're still, in principle, spending time validating the patient, and you're still, in principle, spending time completing the Docman template. If you take MyBotGP, you won't have to do that at all. It will validate the patient in or out, but the letter in or out by itself, and it will complete the template 100% by itself, and it will file it 100% by itself. So it's very, very different. Emails and scans as well. Next question, thank you for that. Next question from Louise. Can we set up the path module to deal with the request from our pharmacy team for med reviews and QoF, but still have other results come back to us? I can see you grinning, Sanj. Is that for you? That's coming. That's coming. He's smiling because that's so. Yeah, we will be launching later on in the year. We won't go into too much detail on it now, and you have to be using this platform for it to work. So it's not something to wait for. But we're adding some modules to this kit. We're always trying to improve it. So the subtle grin that I noticed from Sanj, because I've worked with him for years, is because that's in our list of functionality, Louise. Can you email me the video and slides too, please? Yes, we will email everyone. I'm assuming you from St. Lawrence Street Surgery, is it Dita? I'm assuming you registered and got an email from us. So if you did, then we've got your email address, and then we will do that straight after as well. We've got to tidy it up and clean it up, and then we put it on our website. Oh, good stuff, great, and we'll get it out to you. So hopefully later on today or tomorrow. We'll send that out to everybody. So a couple of minutes left. So do we have any more questions on either of the platforms? Just pop them in, if anything springs to mind. Okay, so do a little summary. So we're not new. We've been doing this a long time. We're a specialist in primary care. These are purpose-built products. Path product is medical device, DCB 129, DCB 160. Docman product has DCB 129, DCB 160 because that's the correct certifications for it. We look after the management and the installation and the configuration. And we take our work very seriously here. Louise, if we agree to go ahead, how fast can it be set up and running? So fairly quickly, pathology can be set. The way that we work with pathology is we plug it in, we let it run for a week or so to suck up all of your path tests, to take a copy of all of the ranges. It won't have seen all of the path tests after a week because some might not have been requested, but we then set up a config call. Most clients add 20, 30, 40 path tests in the first sitting in about 45 minutes because they want to take a careful and measured approach. Don't want to just turn it on and go crazy. And so about a week later it will be running, and then what we do about a week, 2 weeks later, we can go quicker or slower, it's up to you. We have another 45-minute meeting. Now you're familiar with the tool and it will have seen the rest of your path tests, and then we add the remaining path tests, the more complex ones, to the platform. So in principle, up and running after a week or two, probably at full capacity, 3, 4, 5 weeks, but it could be quicker. If you're confident with tech, then that's not a problem, and then we can do that quicker as well. Is it possible to take your contact details so that I can get one of my partners to give you a call to discuss in more detail? Yeah, 100%. James A. Farrell will keep a note out for this as well. Farrell, will you take a note of that as well, please? Are you still on the call?
Yes.
Yeah. Okay, cool. Thank you. For Docman, again, it's a similar principle. It needs to run for a bit to see the letters because you've got to receive the letters first. So depending on how many different letter types you have, it will take week, 2 weeks, 3 weeks, but we're configuring in the background as we see them coming in. So it's going to suck them up. What we do is we then put it, figuratively speaking, we put all your letters onto a spreadsheet and say, right, here's your letters. You tell us what you want to do with them, and then you go through that and say, yeah, file that one, don't need to see it. That one goes to the set a task. That one don't set a task. That one triage to this particular clinician because they like to see those letters. And then we go back in and we plug it all in Docman. Great. So we're just about out of time. I think we got through a lot today. If there's any other questions, please pop them in the chat, and we can answer them. If not, what I'll do is I'll stop the recording, and then we will email everyone a copy of the recording, and then obviously anyone wants to get any more specific information, do let us know as well. Farrell is on here. He's our sales manager, so he'll take care of any queries. Great. So brilliant. Thank you, Tom. Thank you to everyone for joining. It was a busy webinar today. Thank you, Sanj, although I think I overspoke you for most of it this time. Apologies. And yeah, any questions, let us know. And if not, we hope to hear from you. And thanks to you all as well. I'm going to